Sawasdee Krap, and good afternoon once again. Today is Tuesday, the 20th of April, 2021. And this is the English language summary of the daily press briefing here at the CCSA. So thank you to Dr. Tawisin just now, who gave us the summary of the situation at the moment. Of course, he ended with some issues about the hospital beds, which is actually a management in progress, so that we can be ensured that all persons who are found positive with COVID will have hospital beds for treatment. And I'll talk a little bit about that later, especially about the new field hospital opening in Bangkok as well. So firstly, the general situation and the numbers that we record for today. New confirmed case, 1,443, as you see in the infographic on screen. Out of this number, 1,328 are cases of local transmission, 113 from active case finding, and only 2 from the within the state quarantine system. New recoveries is 171. The active cases still being treated, as you see on screen, is 16,119. Unfortunately, we have 4 new fatalities to report to you for today, making the cumulative number of fatalities now standing at 108. The 105th fatality is a 78-year-old individual who had thyroid and high blood pressure. The 106th is a 78-year-old as well man who was a trader in Bangkok with diabetes, high blood pressure, and frequently visited gambling dens. The 107th fatality is an 86-year-old Indian national female with pre-existing conditions like thyroid and was bedbound in Bangkok. She was in close contact with a friend who was later tested positive for COVID. And the 4th, or the 108th fatality, is a 30-year-old business person with a history of visits to entertainment venues in Thong Lo district in Bangkok and had visited relatives in Ayutthaya province. So our sincere condolences to the families of the 4 deceased fatalities. Now, just one observation from those who are still under treatment, the active cases still under treatment. We have around 200 plus severe cases, as well as 55 on ventilators. Additional observations. First is that the numbers right now in Thailand are actually, they keep fluctuating with an upward trend. Although in some provinces, the numbers have improved, province specific. So we therefore continue to ask for your cooperation to be very cautious and be mindful of the various risks of COVID. Today, we have new cases in 68 provinces as compared to new cases in 70 provinces 2 days ago, the day before yesterday. Globally, Thailand is ranked at 107 now in the world on the number of cases found in the country. When we talk about the entertainment cluster, mostly those who have been infected with COVID in the entertainment clusters, most of them are actually patrons or visitors to the area, to the venue. 57% are from those who are guests to entertainment venues. 18% from the staff within the venues itself, and another 17% from those who have contacted those who visited entertainment venues. So this is especially for the people who tested positive in the entertainment cluster. One piece of information regarding one particular province is about the province of Phuket, wherein they have enacted new stringent measures for entry into Phuket for the dates between the 21st, tomorrow, of April, until the 30th of April at the end of the month, which includes those traveling by vehicle and by flights. And they've come up with these new measures to curb the infection as follows. Number 1, Those who have received 2 vaccinations with supporting official documents are eligible to travel to Phuket. Number 2, those who have COVID-free certificate issued no more than 72 hours before departure from the point of origin can enter Phuket. Number 3, those who do not have the said documents mentioned are required to take the rapid antigen test upon arrival and must wait for the results at the airport. So this is there's 2 more. Number 4, those entering Phuket by vehicle from the red zone provinces will be screened at the checkpoints in Phuket. And number 5, before entry into Phuket, passengers must download the Mochana application, register in the gophuket.com application. This is specific for the province, as well as inform the authorities for tracking purposes, and strictly follow all preventive measures. Now, there is this exception for entering into Phuket for those who are transporting goods and who are not staying overnight. They must carry a permission document before being allowed entry into Phuket. Yes, so this is some new information for Phuket effective tomorrow, the 21st of April. Now, about curfew, as mentioned in the briefings that we had earlier this week, and just to take out any misinformation that we might have heard. So there had been some false information spreading online regarding the supposed announcement of curfew in some areas of Thailand between 11 p.m. to 4 a.m. Now, it has been clarified that there's no curfew announced by the government under Regulation number 20 in accordance with the Declaration of Emergency Situation under the Emergency Decree that became effective on the 18th of April 2021. So there have been no curfew. In fact, the time frame mentioned, 11 p.m. to 4 a.m., under this regulation is only applicable to the opening hours of certain venues, including convenience stores, restaurants, and supermarkets, and does not apply to the general public, nor does it imply any ban on travel. It is discouraged, movement is discouraged, but it is not prohibited. And individuals can still make necessary trips as usual during these hours, but please bear in mind that everyone is requested to reduce movement and travel and their interaction with others in their daily commutes during these times for us to try to best flatten the COVID curve nationwide. So just now I mentioned about Field Hospital. Just one related information is that the Bangkok Metropolitan Administration opened the second Erawan Field Hospital in Bangkok Arena Sports Center in Nong Jok district in Bangkok as the fourth field hospital in Bangkok to cope with the increasing number of cases. And the governor of Bangkok, Governor Asawin Kwanmueang, said that patients who showed no symptoms would be treated at field hospitals, adding that these field hospitals offer various facilities such as meals, Wi-Fi, as well as CCTV camera for security. Patients who wish to receive treatment in the field hospitals can contact the Erawan Center at hotline 1669, and officials can also arrange for transport for those who cannot go to the field hospitals themselves. So just an additional point before closing, that as we fight COVID and practice DMHTT in our daily lives, and as we work from home, I believe that everyone is working from home to the maximum capacity at the moment, be they government agencies or private companies. So as we practice work from home, there is another tool to remain healthy is to maintain positive thoughts. Now, mental health is also very important during these times, and the Department of Mental Health of the Public Health Ministry has recommended 4 doses of mindfulness for us, which we can do ourselves without having to visit the hospital. The first, number 1, is mindfulness. The first dose of mindfulness, of the mindfulness vaccine, is safety. as in practicing safe behavior, such as wearing masks, washing hands, and social distancing, avoiding congested areas. The second dose is to avoid panicking by reading and consuming news updates from credible sources, such as the Ministry of Public Health and other agencies, and always do fact checkups. Number 3, the third dose is hope, as hope will motivate us and keep our spirits high for a better tomorrow. And fourth, lastly, is the final dose is empathy, to understand the feelings of other people by listening and sending support to those around us. So this is basically what I have for you for today's briefing. When there are any important issues that are sent to us on social media in our inbox, we tend to take a very short time in addressing those issues. This morning, I also received a message in one of our social media inboxes regarding the information provided in the English language briefing. So we hope to improve that from time to time to include issues that will be of interest. For example, the severe cases of those who have been found positive with COVID, those still under treatment. I mentioned in the earlier part of this briefing, over 222 severe cases now out of the current cases, active cases still being treated. 222 are severe cases, and 55 are those who have to use a ventilator. So that's an indicator of the severity of the cases that we have at the moment. So issues such as these are issues that have been sent to us in our inbox that our audience would like to hear. So when we have these requests, we'll send that to you, we'll deliver that to you from time to time. Another issue is about the availability of hospital beds. There was a certain individual who kindly gave us a suggestion that the audience here might want to hear about hospital beds. However, of course, the focus now is on the field hospitals, which is a management in progress that I mentioned. And mostly, I believe that expats or foreign nationals would be entering into the alternative state quarantine and hospitals more than the field hospitals, of course. I think that's the case. So that's why we haven't been talking about field hospitals as much as the Thai version. But from time to time, when there are information regarding these issues, hospital beds, as per request that we receive from social media, we'll talk about that. The issue about vaccine is very important for foreign nationals as well. So as soon as we receive more information regarding the how and ways and means in all of these registration processes, we'll get back to you as soon as possible for these. So thank you very much for your attention. We'll see you again tomorrow. สวัสดีครับ